All right, today we're going to be doing some sclerotherapy on Wendy. Sclerotherapy is actually the introduction of a chemical, and there are a couple different chemicals that we use. Today we'll be using hypertonic saline. It's a 23.4% hypertonic saline. We introduce it into the vessel, and what we're doing is asking that vessel to actually kind of collapse on itself, and by collapsing on itself, it doesn't allow blood supply to go in and out, and the body reabsorbs the vessel. This particular treatment is very good for your smaller spider veins, red, purple, and pink, not so much the larger reticular vessels or varicose veins. Those require something like intravenous ablation or a tryptosurgeon for that. But we're just going to be introducing a teeny tiny little amount of the hypertonic saline in, and the goal is just to get it in and through the vessel in order, like I say, to get the vessel to collapse and be reabsorbed by the body. Usually takes about 2 months for that to happen once the treatment's complete. So I'm going to start here on Wendy, and these are teeny tiny little vessels. She has had them treated many times before. A little poke, Wendy. But if you see in that area how it all whitened up, all that fluid's gone into those vessels and they will be gone. So now we're going to start next door to where we were, see if we can't get that same result. We've cleared that area all in there. Start back here, little poke, Wendy, sorry about that. And look for a little clearing. And you just keep on moving down the vessels. There's nice blanching you see throughout. And you hold your needle there until you see that blanching stopping. My blanching is actually all the way out to here, and you can see all those vessels in there have turned a nice pink color. So we know we've covered that whole area for her. And I'll come down and try and catch some of these really teeny tiny little guys. Sometimes these can be a little challenging, especially if the patient has had them treated previously. But she seems to be responding very nicely. I've got a little lidocaine in this product, in the hypertonic saline, so it's a fairly comfortable procedure. How you doing, Wendy? Good. All right. And you just continue on like that, trying to get into any little vessel that you think you can get your needle into. If sclerotherapy gets the vessels so small that they are actually smaller than the diameter of the needle, we may want to refer a patient out for what we call a cleanup with an ND-YAG laser to get rid of the very teeny tiny ones that we can't even get a needle into. There you go. Beautiful. All right, we're going to flip Wendy over and do the other side of her leg. That's about all she's got. Wait, there's one more down here. Beautiful. There you go, my dear.